Hafa and good afternoon, everyone. Thank you very much for joining us and to the public viewing at home. Suzuis Masi for tuning in today. This is a roundtable hearing on juvenile justice and the prevention of adult recidivism. I am Senator Amanda Shelton, and I'm joined here today by some of our stakeholders in the community. And so I'll just ask that we go around the table and you introduce yourself and then the role that you play in the juvenile justice system. Start here.
Hafide, I am Alabang. I'm the Guam Congress representative, and I'm the chairman for the Committee on Youth and Education.
Hafide, I'm Samantha Taichino. I'm the executive director of Manyetlu. We are a nonprofit organization that provides youth mentoring and supplemental programs. We also provide programs to adults, mainly to migrants as they're transitioning to their lives here on Guam, but we also have a partnership with DYA where we provide programs in their centers and then also in their correctional facility. And we also work with DOC on their RSAT program. So we provide workforce development programs to those who are getting ready to get out.
Hafide, my name is Corrine Bendicho. I am the Acting Youth Development Administrator for the Department of Youth Affairs, specifically the Youth Development Division. And my role is pretty much to oversee the three resource centers within the community, one located in the northern, the Lago Center, the Cutton Center, which is a central center, and the Haza Youth Center in the south. And we provide a lot of outreach programs and activities to pretty much all youth of all ages throughout the island of Guam. Additionally, I oversee the Counseling Case Management Unit, and they are the ones tasked with the providing social work to the youth that are offenders within our facility.
Hafide, and good afternoon, everyone. My name is Melanie Brennan. I am the Director of the Department of Youth Affairs. We operate the only secure correctional facility for youth on Guam, as well as the community resource centers that Corrine just mentioned. We partner very, very closely with non-government organizations to provide positive youth development to our kids in the community and to our kids that are incarcerated.
Good afternoon. My name is Kristinda Uggan. I am the Deputy Director of the Department of Youth Affairs, and I assist the Director, Mrs. Brennan, ensuring the mission is accomplished.
Hi, I'm Carlo Dizon. I'm an attorney at the Public Defender Services Corporation. I've worked with juvenile clients and have represented juvenile clients before courts that have entertained those types of cases. I primarily work on drug offenses, which has some kind of overlap with recidivism and with youth who have, we see a lot of people who have, we found who have appeared in drug court have also had instances of drug use while they were youth, while they were young. So that's an area of concern for us.
Good afternoon, everyone. I'm Jane Flores, the Director of Bureau of Women's Affairs and the Administrator for the Governor's Community Outreach Federal Programs Office, and I'm here in my capacity to work on responsible sexual activity for teens, teen pregnancy rates and STD, and sexual assault.
Thank you very much, everyone, and thank you for joining us today. So, the reason why we called this roundtable hearing today is to have a discussion about our juvenile justice system and ways that we can prevent adult recidivism. Because when youth offenders go on to become adult offenders, as we know, the lingo in the youth justice system is that they've graduated into adult crime. But this is a graduation that we want to prevent, right, as a community. So if we want to stop crime on our island, I think that the most effective method is to treat juvenile offenders before they become adult criminals. So once they are adults, it's really hard to change those types of behaviors, and that kind of goal is harder to accomplish down the line. So in this roundtable, we want to talk about, of course, the juvenile justice system as it is, and what you, the experts, and the stakeholders on the ground think is the ideal way that we should be working, or methods that we should be using moving forward. If there's anything that we can do to improve, or if there are any gaps that we can recognize today, and see if there are policy solutions that we can present to drive that kind of change. And so we also want to talk about the different treatment approaches that might be happening at DYA. We also invited folks from DOE and behavioral health, and hopefully they'll join us, but maybe you as well from DYA can speak to those. And we have our nonprofit partner, Menyetlu, here to understand the comprehensive treatment program that's being offered to our youth. And just to talk about the numbers, the rates of juvenile crime in recent years, and how that has contributed to the climate overall that we're feeling in the community. We've been having these community safety meetings and lots of concerns that are being voiced, and so how we want to look at how there is a connection between our juvenile crime rates and what we're seeing in the bigger picture. So if we can just start by talking about the arrest process. I know that GPD and DOE are not here at the table yet, but maybe anyone from DYA, if you can give us a little bit of a rundown of when a youth offender commits a crime, what is the process that happens, the arrest process, if you are aware of that and can share a little bit of those details.
Thank you. Thank you so much for calling this roundtable. I think it's really important that all key stakeholders be available to address questions like that. So often we operate in silos, and when we don't understand what the other hand is doing, it makes it really, really difficult to identify like what specific need a particular youth might have. For the Department of Youth Affairs, when a youth does come into our youth correctional facility, of course they are brought either by the police department, the Guam Police Department, or the Probation Services Division on a violation. Normally what happens is there are two kinds of offenses that a youth can commit. One is a juvenile delinquency offense, which is pretty much a juvenile crime, whether or not it's committed by an adult or a juvenile. The other is a status offense. A status offense is an offense that only a youth can get committed for or arrested for. These are things that an adult would not be arrested for. For example, truancy, or beyond control, or a curfew violation. So it's important to note that when kids commit status offenses, a judge can also remand them to the Department of Youth Affairs or back into the home. What we've learned what traditional research has shown us on adolescent behavior is that you cannot treat a youth as an adult. There are distinct differences, and when you do that, you really are doing more harm to the youth that you're working with. Very recently, the Judiciary of Guam engaged in juvenile justice reform. It started in the end of 2014. And what happened was they engaged with the RFK National Resource Center for Juvenile Justice. They came out, they reviewed the whole probation system, and came up with 15 recommendations on how to handle juveniles that come into the juvenile justice system, how to do it better, how to work with them so that you really end up improving youth outcomes, stopping that gateway from a juvenile coming from the youth correctional facility and then just going straight into the Department of Corrections. So they made these recommendations, and of course implementation has taken quite some time, but what they've done is they first implemented risk and needs assessments. These assessments look at certain categories such as predictive behavior, like patterns of behavior, prior records, whether or not this youth has parental support, how they fare in school, just what kinds of support system this youth has. And so if anything, if you're dealing with a low risk, they normally self-correct. So for example, if somebody is just being a normal adolescent and is experimenting with alcohol and they get arrested and they don't have any priors and they have good, strong family support, the research suggests that you don't make them mingle with medium or high-risk kids, and you try to divert them out of the juvenile justice system. Okay, so before, what we were doing is we were treating all youth, regardless of risk level, the same. So if on one day a judge had 4 youth in front of them, they all committed the same offense, and he could send all 4 of them to the Department of Youth Affairs. Now what they're doing is they're actually doing assessments, and they're making recommendations to the judge, better informing the judge of risk level and the need to remand if necessary. So with juvenile justice reform efforts, the Department of Youth Affairs actually saw a decline in the number of youth that are actually at the facility. So in 2014, they averaged 80 to 100 youth, which of course exhausted our resources. The correctional facility was overcrowded. And so with the implementation of reform efforts, we actually currently now have just in the youth correctional facility, even though we have custody of approximately 50 youth, only 26 actually reside in the correctional facility. And so these 26 obviously are medium to high risk, and they do require resources. But the beauty of reform is that the resources are now spent on those kids who need it most.
Okay, thank you very much for that introduction of how the process kind of works and the changes that we've seen over time. I know we don't have anyone here from the AG's office, but I wanted to talk about, walk through the judicial process and about how an offender is detained before pretrial or whether or not they're released. How is that decision made within the judicial system? And I know we have the public defender here, and you've represented maybe some youth who, and you have some knowledge about this, if you can talk to that a little bit.
Yeah, you know, I've had a bit of exposure with youth offenders, for example, facing the magistrate judge. In a lot of those circumstances, the offender usually isn't brought to the court. The magistrate's hearing usually takes place remotely, so the juvenile in that instance would be DYA, accompanied usually by a DYA officer. The juvenile's family members would be in the court, and during that process, it sort of unfolds similarly to how a typical magistrate's hearing would for adults who are arrested. So the judge reads out what the offenses are that are being charged. He looks at the records that a juvenile might have that might speak to the juvenile's family background or level of education or financial background. And the magistrate judge makes a finding on whether there's enough in the declaration by the Attorney General to determine whether the charges will go through, in which case, the judge makes that determination at that instance, and then the juvenile is continue to be detained at DYA. We see in those circumstances, there are several issues that typically arise. Usually, for example, sometimes the juvenile might be detained and there's not enough communication that occurs between either the DYA or the AG's office or our office and the juvenile's family. So in some circumstances, the hearing might not be able to continue if the juvenile's parents are not present. In other circumstances, there's might be communication issues. For example, we've seen that certain populations who, for whom English is not a native language, might come before the court, and because the process happens so rapidly, and even I think the process itself is so can be pretty cryptic that even native speakers who are young and have not been exposed to the process before might have difficulty understanding what's actually happening. And because they're being detained at DYA and being magistrated remotely, we're not there present with them in the room to explain to them what's actually going on. So it kind of feels like at that front end of the process, it kind of feels like they're being just shepherded through the initial steps during which they're formally charged. After that, when they're released or detained at DYA, then we have an opportunity to speak with them and kind of explain to them. But usually those first steps are pretty rough. A lot of the juveniles don't really know what's going on for the most part.
So I do know that part of the reform effort was to look at court language and to adopt easier terms for children to use. And I know that that was one of the working documents. I'm not completely sure if it was ever completed, but I do know that that was a huge concern, not just locally, but nationally. The language was too formal, too difficult to understand for kids, especially the kids that we deal with. I also know that the youth that are brought into the brought into DYA from the police department are often unaware of the processes that will take place. And again, just like the adult system, youth are innocent until proven guilty. And so at least with the youth correctional officers at DYA, that is something that is explained to them, because obviously if they've never been to the youth correctional facility, they're often very afraid. Some of them come in crying, just depending on their ages. And we at the youth correctional facility, we do try to make that, because it could be very traumatizing, less traumatic by engaging with them, by talking to them, by explaining that you will be heard, or in some cases, the Attorney General's office will just cite and release. And so we try to explain what the process that we're aware of. Sometimes, though, with the Attorney General's office, as you know, they have so many hours to come up and decide whether the case is going to be charged out or not. And so we have no control over that time limit. So I really think that defense counsel, even more so, has to be present for a minor's initial appearance, even more so than in adults. And I know that had started with the adults. I believe it was last year as part of pretrial reform, but that also is very important. I do, in my experience, in just my few months there, I've seen a few attorneys come up to attend the hearing, but again, it happens remotely. And so if defense counsel are supposed to be advocates for the youth that they represent, then they should actually be physically present at the youth correctional facility. Someone should talk to them, someone should come up, advise them what legally has to occur and what to expect.
Thank you for that. I can only imagine everything going through their minds at that time and just being overwhelmed with so many different feelings and new surroundings. So thank you for that contribution. And so maybe, I know that these questions I prepared are maybe more for the judiciary or for the police department, but on pretrial release, is there any kind of monitoring done for these youth?
Okay, so
I know you
since
bring
here,
the experience
since I'm
too
here,
from the
and since
judiciary, so we're okay.
Since I work for the court. So right now, I just want to explain, our population at the Department of Youth Affairs that are currently there, they're made primarily of pretrial offenders. Some of them are there because of they're post-adjudicated, but they've committed violations on their probation conditions. So most of them that are there because they can't either be safely managed in the community during their pretrial release. I believe it's called, these conditions are set at a preliminary hearing. So are there conditions? Yes. If they're released, they will have conditions. They will have conditions just like an adult would have. They try to make them less stringent because they are on so-called pretrial, it's pre-adjudication, and they are monitored by the probation division, primarily if they're released right from the get-go. Okay, but if they're not, if they stay at the Department of Youth Affairs for any amount of time, what happens is the counseling case management unit will assign a social worker that will appear in court and await the determination of the judge to release. And if they are released pre-trial, it's called extended authorized leave. And so they are allowed to go to a non-secure facility or back home with their parents pending the adjudication process. Okay. So they do have conditions, but again, through juvenile justice reform, we know better than to give them standard static conditions which just make it more difficult for the youth. Oftentimes, or before, traditionally, they used to have reporting requirements saying that you must be here, you must report in person. That has since changed based on the fact that youth cannot drive. They aren't in control of their own transportation. And so now we try to make it easier, or the court tries to make it easier. The justice system will say, okay, you can report either through treatment, you can report through telephone or email. So we are making transitions, we are making it easier for the youth that we work with. And we're taking into account when we provide services that it's not just a service for that one particular youth, it's to engage the family and other siblings to help overall recidivism reduction.
Okay. And would you say when these youth are on extended authorization, are they usually still attending school?
So the social worker or the probation officer assigned to them will ensure that they are. Now there are cases where, and I'm sure anytime one of our kids makes the news, that you hear that, oh, they currently had, a case. Our supervision primarily is during regular working hours. If we do need assistance, we like to call on probation or GPD for that. Our mandate really is to provide supervision, and so checking a client on weekends, so those can be challenging, but we try to flex our schedule. Can't be with them 24/7, but the conditions are 24/7.
Just really quickly, so they do attend classes, and part of the check is the judges who oversee those cases actually look at things like attendance records. Mm-hmm. So we have representatives from DOE who actually show up in the hearings and verify whether the child has been attending class, and that's part of, the judge takes that into account actually on whether the child will continue to be released or will be sent back to DYA.
Okay, good to know. Thank you very much. Okay, so if a youth is determined to be guilty, what options does the judge have for incarceration or for treatment?
So treatment is always a condition regardless of whether he's going to put, the judge will put them at the youth correctional facility or allow them back in the community. Or if there's a transition plan of maybe 6 months at the Department of Youth Affairs and transition out. I like to tell the social workers at DYA, as soon as somebody comes in, start transitioning. What is the transition plan for them going out? Oftentimes, youth that are at the Department of Youth Affairs, oftentimes it's a placement issue. We find out that, the home is substandard and the judge is concerned, or there's no parental supervision, there's no parental support, or they have problems, attending school for whatever reason. I don't particularly like the fact that sometimes kids are there just for placement, but if they're ordered there, the Guam Department of Education does provide a school program. It's called Lihing Thamaguan, and that program operates throughout the year and during the summers. They provide educational credit for the kids that are there. The issues that I have are if a judge is going to put a youth there strictly for school, they have to recognize that Lihing Thamaguan is just a program, and they have to accommodate all ages at all different kind of learning capacities, and we do try and separate the boys from the girls, so it's really a difficult program to administer, and so I'm really thankful that GDOE does operate in the Department of Youth Affairs. However, it's not the ideal educational school setting.
And what would be a recommendation for an improvement to that setting? Aside from the separations of the male and the female, what else would you recommend?
Well, we have, we work very closely with GDOE, and they do know that our concerns are, number one, we have to separate status offenders from delinquent offenders. And so we have asked for additional teachers to be assigned to the Lihing Femaguhun program, and just to recognize that they are, right now currently, we have two 11-year-olds, one 18-year-old. Gosh, I should have brought the breakdown of the different ages, but imagine summer school had only two instructors, two teachers. And so they had to work with 11-year-olds who might be behind. Mostly our kids are not performing at their academic levels. And so just the challenge is ever present, and we have asked if at all, if they can. Most of our kids have special needs, and so we've asked for more instructors.
Okay. And you mentioned that in the transition planning, if a child is not able to go back to their home because of whatever the circumstances, I was wondering if in any transition planning, is foster care ever an option?
Foster care is actually is used. We have dual status kids, and dual status kids are defined as those kids who are within the justice system, but also within the child welfare system for whatever reason. Many of our kids, like I said, lack the needed parental support, and so oftentimes they will also be a part of the child welfare system. It's not uncommon that you have multiple social workers working on the same case, and yet at the same time, there's very little communication. And I know defense counsel here was saying that, yeah, they all come to court, but sometimes they're just meeting each other or just hearing, new information. Again, collaboration is good. It should be a hallmark of juvenile justice reform. We need to collaborate. We need to speak to each other so that we're not wasting resources, but we're all on the same page. Another issue with the sharing of information is everyone thinks, oh, I can't release that. It's confidential. And so nobody really speaks to each other. Improved confidentiality agreements would improve the juvenile justice system all around. I mean, I used to work for probation, but when I call probation, they're very tight-lipped about information. Sometimes the Department of Youth Affairs will have a youth that's remanded, and we don't have any of the information, so we don't know whether or not this individual needs to be separated from the larger population. And we just work with them. Our officers just work with them until we get the actual paperwork. But even at that, it's very limited because they're minors, get initials, and if the kid's not going to tell us their name, or a lot of them don't even know where they live, their actual addresses. So it's that data, that sharing of information that we could honestly improve upon.
Okay, thank you very much. And Ms. Taitino, maybe you can talk a little bit about the programs that you offer within DYA and whether or not those are used as a form of treatment.
Okay, so thank you for having me here. We've been partners with DYA for a while now, but it's kind of really jumped into being extremely active now that Director Brennan is here. Just a little bit of the backstory. We've worked in DYA Hadza, I believe we've also done in Katan and Lagu some of our classes. So we provide evidence-based curriculum. The ones that we usually provide to the kids there are our Skills to Pay the Bills and Money Smart, which prepares kids to enter the workforce. So Skills to Pay the Bills is really about communication, and then the Money Smart is about financial literacy. So we run those programs regularly, usually like once a year. And then so recently we started working in the correctional facility where we're going to be doing 2 hours once a week. The first hour is presenting them with an evidence-based curriculum. So again, we're going to start with those workforce development programs, and then we're going to start moving into some of our other programs, such as Positive Action, which is another evidence-based curriculum that helps improve a child's self-image of themselves. And the whole idea behind that is if they feel positive about themselves, that they will do positive things. Also, a big component of all of our programs is physical activity. So the second hour is usually reserved for that enriching activities where we either do sports. Right now we're focusing on sports, but we're also having guest speakers come in to talk to the kids or do demos, like a cooking demo, things like that.
So just in terms of treatment, we do have on staff a clinician, Ed Titano, and so every child that comes in, every youth that comes in is assessed on the MACI. It's a behavioral health screen. If there's any indication of suicidal ideation, if he scores high, or it's in a cautious or hazardous zone, they're immediately referred to our clinician. So our clinician has uncovered, some mental health issues, some abuse issues, past abuse issues, some educational deficits, and makes referrals appropriately even while they're in. And it's part of the transition plan that the social worker will get, but we do try to provide services. We've been working very closely with Manetlu, and I appreciate, any time that they can bring positive youth development opportunities for our kids. And someone might say that, oh, well, you don't have any data that shows that these are effective. We're filling time. We're giving kids options and opportunities that they probably would not have anyway. We're trying to use a developmental approach, understanding that adolescents, again, are different. And some of their behavior that they engage in, risky behavior, is normative. Although we call it inappropriate because they're out in the community, and this is the time where adolescents will try to assert themselves as individuals, where they're, it's normal that they're heavily engaging in peer influence rather than listening to parents. And so we just wanted to make sure that we fill the time, even when they're in the youth correctional facility, with positive opportunities, whether it's sports or art, or just trying to cultivate positive interests in the kids that we work with. I think it'll go a long way in terms of prevention, giving them opportunities. Some of the kids have learned how to play an instrument, or have a newfound, it's like, oh, this is their talent. They're jump roping, or they're doing different things from before. And so the idea is to give them more than when they came in with. And so I'm really indebted to the nonprofits and for Sam coming in and making. A lot of people don't want to come in. I don't know, that they want to go to the youth centers and work with the kids that are low risk. But I need people, and again, I need opportunities for the higher risk kids that will eventually leave the Department of Youth Affairs.
Okay, thank you very much. And you mentioned in the assessment of the clients that you use the MACI tool. Can you give us a little more information about that, and whether or not that you think that is the ideal assessment to use, or if there's something that we can look to that perhaps is a more effective tool that you know of?
So the MACI tool was introduced to the Department of Youth Affairs when I was still working at the Judiciary of Guam. It's a behavioral health screen. It's only a behavioral health screen. Okay. So it really is just the youth that arrive at the Department of Youth Affairs are 2 to 3 times more likely to attempt or engage in some kind of suicidal activity. So we want to make sure from the get-go that if they are depressed, if they rate high on the scale, that they are seen immediately by our clinician. We just want to make sure that they're safe. We're supposed to provide a safe and secure environment for the youth that we receive. And so that is just one screen. Okay. I would love to adopt a detention screen so that my social workers can say to the judges whether or not detention is the right idea, if they just cannot be properly managed somewhere else in the community. Because the Department of Youth Affairs is a secured facility. You've been there, you've seen it. It is jail, basically. And I don't believe that most kids belong there, regardless of their offense. Again, I'm the believer that kids are going to act out. Adolescence is the time where they will engage in risky behavior, whether it's trying drugs or alcohol, or being easily influenced by their peers to go climb over a fence, stay out late, do these things without parental support. They're going to listen to their friends, to their peers. And so I don't believe status offenders belong there. I don't believe a secured, I believe that our numbers can be lower. And so I believe a detention screen, any kind of evidence-based screening tool, could better inform the judge. The problem on Guam is we don't have very many alternatives to detention. And so, I mean, I'm even interested in looking at electronic monitoring, just any other opportunities. You talked about foster care, you know, if the parents aren't, if they're part of the child welfare system, but understanding that family court always focuses on reunification and how that foster care experience might also affect the youth.
Okay, so I know in the research that we've been doing as a committee looking at the juvenile justice system, we've seen in the research that it's the therapeutic intervention and really good assessment that's needed. So to hear that from you today, that we need these other tools for assessment, realizing that we only have this one behavioral health assessment tool, I think really urges us to look at some other things that can help us to better help our kids in the system.
And I just want to say that I know that there have been questions about the use of specific tools. Like I know that currently the judiciary is using for adults the Ohio Risk Assessment System, and people have, you know, questioned, well, why are you using that state's? It's probably not pertinent to, you know, our local community, but you have to start from somewhere, and then you can norm it for your own population. So if it's not working for your population, you need to save the data, you need to let the data speak to inform policy. And so I believe that these tools that are being used off-island can be replicated and used here, and eventually, even if it's the University of Guam, they can do research studies to see how effective it is, and if it isn't, norm it for this population.
Okay.
Yeah, if I can just add,
Sure.
So I just like to also emphasize the importance for kind of data sharing and collaboration between the different groups in sharing the information they have about a particular defendant. You know, if you ever attend those juvenile hearings before a Superior Court judge, usually Judge Bordallo, for example, it's really impressive the number of stakeholders you see sitting in the jury box, all sort of speaking about their experiences with that individual and types of analyses or treatment that that individual is going through. But, you know, that also means that, you know, for those 8 to 10 people, those are 8 to 10 different files all about the same child, right? And it's not clear whether there's an established channel for those groups to share that information on one end, and on the other end, you know, after an individual graduates or enters adulthood, for example, and you know, let's say gets into trouble as an adult, a lot of the treatment that that person might undergo as an adult should build on the treatment that they received in, you know, their juvenile years. But there isn't also a clear channel, like longitudinally from childhood to adulthood, as well as, you know, during the juvenile years between the different groups dealing with that individual. And so, definitely any attempts to kind of clear those channels would be great.
Okay, I think you kind of answered one of my next questions, which was about how when a client leaves DYA, what kind of bridge program they have to go back into the community, and how what kind of therapy is available to them, and how you connect with their school and their social workers or counselors to see, you know, how they can enter back into the community and, you know, not become an adult offender. So knowing that information, I think there's much that we can improve on. I think just to wrap things up, I'd like to ask a little bit about how much of your resources you think you're devoting to counseling and skill building for your clients versus the amount that you're using for detention. Would you say that we need to see a shift in resources or more resources towards therapy?
Are you going to give me more money?
I mean, we want to understand the need, so.
So So as you know, I have been able to shift some resources just based on the population being lower at the youth correctional facility. But keeping in mind, though, that whether I have 100 kids or I have 20 kids, it's still a 24/7 operation. And with transport the way it is for clinical assessments, for medication or hospital runs, I'm always going to need to I'm always going to have a need for the youth correctional facility. So right now, the question is how much of my resources? I would say a little more than half are dedicated to the youth correctional facility. Ideally, it should be larger in the treatment and aftercare area, and I think that that has always been my position since I got there. I would like to be able to better shift my resources, but the way the budget is right now, I'm unable to. But again, that doesn't stop me. I have engaged with numerous nonprofits like Manetlu, and I support like Sanctuary and other organizations that really do provide positive youth development experiences for the youth in the community and with the youth correctional facility clients.
Okay, well, thank you for that. I'm glad to hear that you're being creative and innovative in what you're doing. Of course, making all of our dollars stretch much further than we've ever had to before, and bringing the resources that we need to the kids is all of our priority here. So I appreciate everything that you're doing to make it work at DYA and the partnerships with Manetlu. And of course, thank you for being here from the Public Defender and from the Bureau of Women's Affairs and the Federal Programs Office. We appreciate your presence here today. So I think, yes, of course, go ahead.
I just have just a couple more points that I wanted to mention. So our population at the youth correctional facility is primarily overrepresented by the FSM population. And oftentimes when we are called to the table, whether it's the media wants to talk to us, they always want to talk about that specific population. So we really are working very, very hard to address the disproportionate minority context that we have, to figure out how best we can serve them, how better we can serve them. And again, sometimes I feel like the media has a huge responsibility and in shifting community attitudes about youth crime. And I really want to work closer with these stakeholders because they really have an opportunity to shift how the public views juvenile crime.
Yes, thank you very much for that. And I know that you are doing your part to do that, especially with the youth resource centers that you have and the other programs that are not just focused on corrections, which is part of your mission that the public, I don't think, really realizes that DYA is tasked with more than just youth corrections. You have all of these things on your plate as well. And so I've been very glad to visit your resource centers and to see the work that you're doing with your other youth clients who are with you on a daily basis who are not in the corrections facility. So Sujuas Masi for that. And I'd just like to recognize our representative from the AG's office. If you'd like to introduce yourself, please.
Hi, good afternoon. Carol Henkel Sanchez with the Attorney General's office.
Thank you very much. And, I just wanted to kind of recap everything that I took away from this conversation, that we have really distinct differences between treating our adults and our youth that we need to focus on, and that we need to treat this population differently and with extra special care, because we don't want to see that adult recidivism once they move out of the DYA system. We don't want to see them graduate into adult offenders. And so some things that you've all shared today is that we need improved communications and collaboration between all stakeholders to streamline and share the information that we have, and maybe some new confidentiality agreements. That's something that we can look at together. We need to improve our education resources within the DYA facility, within the corrections facility, so that our kids don't fall behind, and that we need better screening, more than just the Macy's that we have for the behavioral health screening, but also to help our judges really give the proper placement and treatment that our children require. And so I know we have to start somewhere. We need, these different assessments. And so I look forward to working with you, and hopefully in the next roundtable or next meeting that we can have more of our stakeholders here, GPD and DOE, to help us get a better picture, a fuller picture of what we're really dealing with, and move forward from there. So thank you very much everyone for being here. And the time now is 2:53 p.m. and this is the end of the roundtable. Sudzios Masi.